Nikki, you're going to have to delegate. All right, welcome to Deuk Spine Institute. I'm Dr. Deuk Majan. You're trying to do two people's job. You're moving slow. You need to get somebody else to help you. I need that pedal off the floor. We have just completed a lumbar Deuk laser disc repair. 4 discs, patient from California with horrible back pain. 7 years, worse since October. I need a shot. I see, so we don't have my monitor over here. Okay, I need the lights down. I can't see the monitor. Guys, same thing every time. Very good. That's better. So 7 T1 76543. All right, make an incision here. We are performing a cervical Deuk plasma rhizotomy. What is that? Did you prep higher than this?
Yeah.
Why is this thing so low then? All right. You're watching live spine surgery, and because of that, you're going to hear and see everything as it happens in the operating room. Now, when you watch other surgeries online, you can see an edited version where they show you everything they want you to see. But at Deuk Spine, we don't edit. You get live surgery. You're going to see everything. So, in a real operating room, sometimes the staff don't do what they're supposed to do. The surgeon gets angry, throws things, yells at people. I don't throw things, but I do yell from time to time. You're going to see it all. 7, 6, 5, 4, 3. I need to go a little bit further north. This patient who just completed the lumbar Deuk laser disc repair for 4 bad discs also has facet joint pain. Look at the arthritis. It's massive arthritis in his neck. Okay? And that arthritis can be very painful, and that's why we're here. We're here to treat that, and most doctors do what's called a radio frequency ablation, but radio frequency ablation does not last and doesn't work often. So we've developed a new procedure. It's a rhizotomy, but instead of being done with RFA, we do it with plasma and a probe shot that I developed, the use in the operating room for this purpose. All right, shot. Perfect. That's right where we want to be. Any questions?
At this moment, no current questions.
Well then, Henry, let's show the audience
Yes.
how facet joints can be so painful. Okay, well, you can see from our video that the facet joint causes pain by inflammation. Shot the same way the disc causes pain, inflammation. But this time it's inflammation in a joint in the back of the spine called the facet joint. And it's a very common cause of pain. In this patient, it's in his neck. Shot. Now he comes from California with his lovely wife, and he was offered more invasive type procedures. He did not want them. Shot. The other procedure you can do for this kind of pain is a fusion. A fusion will work. if you fuse the entire spine. Shot. Of course, this patient did not want a fusion of his entire spine, and I don't blame him. I wouldn't either. I've done 1,000 fusions on the neck. I know what it's like to do it and to see the patients recover from it. Shot. And it's not something I would want for anybody. So being able to do this procedure minimally invasive, outpatient, is wonderful. To get rid of pain permanently. Shot. All right, so that's 3. We've already done 4. Shot. I'm moving down the spine. He may be a little bit light, I don't know, but I'm okay with him, but he seems to be lightening up. We do want him to wake up. I only need about 5 more minutes maximum. Dr. B. Shot. Shot. All right, I'm right on top of the bone where I want to be. Shot. 2 medial. Shot. And the arthritis is really, I'm not struggling with it, but it's not making it easy for me. But that's the perfect spot right there to kill the pain nerve. Shot. That's good. Need to be a little more medial. But everything is going well for this patient. Once again, he's from California. He's here with his wife. And he did not want to live in pain. He was only offered more invasive surgery there. More invasive treatment he didn't want. Deuk laser disc repair. Yeah, Luis just reminded me he is having a Deuk laser disc repair on Thursday.
I think it's what, a 1 level?
Yeah, I think you're
Yes.
right. Almost done. Shot. Just got to make my way down, a couple more vertebrae, and we'll be done. Questions?
At this moment, no current questions. So in the meantime, why don't we show the audience of how the Deuk plasma rhizotomy works?
I think it's a great idea. Shot.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. We are literally putting our final touches, and we'll be done in a few seconds, on the cervical Deuk plasma rhizotomy, which you've watched now how it's done. And basically we're destroying pain nerves to the joints. Pull out, Jordan. Let's show the audience the tiny incision everything is done through. So this is the back of his neck on the right side, and it's literally a 4 mm incision. A Band-Aid. And I do put a staple just because you're going through muscle, and sometimes the muscle will bleed from the procedure, and you don't want the patient to go home and it starts bleeding and then they're worried. You know, a little bleeding is not a problem, but it's best if you avoid that. All right, thanks for joining us. Any questions?
No current questions.
You've watched a cervical Deuk plasma rhizotomy. On the right side, C3-C7 for severe arthritis in the facet joints, facet pain. This is the only permanent surgery to fix facet joint pain aside from fusion. And it's much less invasive. Our patient will go home in an hour. Thanks for joining us. I'm Dr. Deuk Majan. We'll be back shortly with our third surgery of the day, which is a 2-level lumbar DLDR for disc pain and then a piriformis release for piriformis pain. Thank you.